After finishing this module, you should be able to understand the basic concept underlying mindfulness, gain knowledge about relevant related concepts to mindfulness, understand various concepts relevant to mindlessness and their drawbacks, know the various benefits of mindfulness, discover ways to achieve mindfulness, interpret how one can purposefully apply mindfulness in their lives, and also to learn how mindfulness can have an impact on the perception of famous practitioners. We'll also get to know how mindfulness helps through the perception of famous practitioners. First, let's understand what mindfulness is. Mindfulness is deeply rooted in the realms of Buddhism. It's been given its due regard since its resurgence in the recent times. The topic is not confined only to the spiritual and academic exploration, but also has become part of popular imagination. Mindfulness is a gift of Indian Buddhist tradition and the Pali language espoused by them. The Pali word for mindfulness is sati, also meaning retention and alertness. Mindfulness is also the intentional, accepting and non-judgmental focus of one's attention on the emotions, thoughts and situations occurring in the present moment. In layman's language, mindfulness is living in the present moment without being preoccupied by thoughts of the past or the future. It is a quintessential component of Buddhist practices of meditation, also including Vipassana, which is insight into reality, Anapanasati, which is mindfulness of breathing, and Satipatthana, which is foundation of mindfulness. Mindfulness originated as a movement to invigorate compassion, peace and non-violence in the world. Gradually, its areas and degrees of impact have expanded to a vast number of areas such as medical practice, psychology, research, personal well-being and awareness. It improves and enhances relationships at home and the workplace. The notion of mindfulness is mostly aimed at inculcating a sense of self and the capability of creating positivity. The practice of mindfulness is now increasingly used in the field of psychology to treat mental health disorders such as anxiety, depression and chronic disorders. Psychologists and therapists have formulated contemporary therapies infusing mindfulness and psychology. These therapies are now successfully used in therapy and contemporary researches to treat not just emotional or mental health issues, but also physical disorders such as chronic pain, diabetes, and cardiovascular illnesses. Brown and Ryan in 2007 believed mindfulness is interpreted subjectively depending on who is studying it and how is it applied. While some define it as a state of the mind, others define it as a set of skills and techniques. Needless to say, the research in mindfulness has been increasing steadily to a great extent. Now let's understand certain concepts related to mindfulness. It has certain concepts which are similar to it in theory and practice, and some of these concepts can be listed as the following. First is awareness. It is the ability to be conscious of the events, objects, surroundings, or a particular situation. Awareness can be either internal or external. Being conscious at every moment is what awareness or mindfulness is about. Spiritual leaders, philosophers and psychologists have propagated awareness of the self. Various people have postulated theories regarding it. Duval and Wickland says that self-awareness based on motivational properties deriving from social feedback is what mindfulness is. It is of utmost importance to be aware about one's choices, goals, values and beliefs. Spiritual teacher Osho believed that awareness while meditating means accepting life as it comes. The second concept is wakefulness. In the context of mindfulness, wakefulness has a different meaning. It can be best described as a state of awareness in every waking moment. Wakefulness enhances our subjective well-being and heightens our contentment with our inner selves and the world. Positive evaluations. It is an inability to inculcate positive evaluations of oneself or self-acceptance that could lead to emotional difficulties. If an individual is engaging more in self-evaluation than self-acceptance, he or she is more likely to compensate for the deficits perceived in self. Someone who accepts oneself as he or she would tend to be mindful would make more mindful choices. The opposite of mindfulness is mindlessness and negative evaluation. When we are studying mindfulness, we also need to understand what mindlessness is to understand the difference between the two. Mindlessness is a state of mind in which the individual is neither mindful nor aware. According to Langer, many have procured such mindless activities in order to escape from feeling lamentable or dejected. Practicing mindlessness tends to put one off track in any and every aspect. Mindlessness practices can be identified in our daily routine. For example, the practices of body, speech and mind. Specifically, for example, flipping TV channels, trying to study with house party music, blaring to the music system, or leaving all the lights on when leaving your apartment, etc., are certain things that we do when we are acting mindlessly. As mindlessness may be concerned with past, it can also happen in cases of preoccupation with futuristic thoughts, like fantasizing or obsessing about the future with unrealistic demands or dwelling on the pleasant memory. Inculcating positivity and mindfulness gradually in self, or maybe with the help of a professional, can reduce the acts of mindlessness and other negative outcomes of it. Another concept of mindlessness is negative evaluation. Self-depreciation or negatively evaluating oneself is a self-derogatory practice. Evaluating oneself with negativity would always lead to difficulties like lack of self-confidence, poor academic scores, drug or alcohol dependence, to name a few. Mindlessness can also lead to a very rigid and stereotypical thinking. Toomey has distinguished between mindful stereotyping and mindless stereotyping. Mindless stereotyping has been characterized by holding a perceived negative stereotype, condemning any new incoming information, and engaging in cognitions and behaviors, favoring the in-group and being biased and discriminatory towards other groups. On the other hand, in contrast, mindful stereotyping can be characterized by holding the belief consciously, metacognitively, that we are part of an entire group and are open to a new incoming information and are better at dealing with others. A Hindu concept, or rather an Indian concept, of Vasudhaiva Kutumbakam helps us in renegotiating or redefining these stereotypes. Now, how can we achieve mindfulness? Mindfulness is extremely crucial for a positive state of mind, so its role in positive psychology becomes even more significant. One can achieve mindfulness through practicing mindfulness meditation. It's a systematic way to focus your attention. It can be practiced on your own by following instructions from an audio clip or even through books. A meditation teacher can also be consulted to practice mindfulness, who could guide one during practice. Also, there are various institutes which conduct courses on mindfulness meditation. This particular module, when you're talking about it, will help you in achieving mindfulness. One of the researchers, John Kabat-Zinn, has listed 5 steps in achieving mindfulness in its true nature. These are: first, entering; second, sustaining; third, deepening; fourth, ripening; and fifth is practicing. Let's look at these steps one by one in a little brief manner. What do we understand by entering? Entering is the beginning of mindfulness, and it starts with inculcating awareness about one's thoughts, words, deeds and reactions. For mindfulness meditation, it is necessary to be aware of our own breathing. As our breath, when we observe our breath, we become more mindful of ourselves. Buddha's teachings find awareness of breath as an important phenomena, as it contains in itself one's capacity for wisdom and compassion. According to Kabat, awareness of breath is more concerned with our attention than just the mere process of breathing. It is about the oneness of the perceiver and the object, situation, event being attended to. Mindfulness meditation should not be considered seriously, as it is supposed to be an effortless element of our lives. It should be pursued with authentic integrity. Mindfulness is to be present in the present. Preoccupation with thoughts of past or future disrupts the process of meditation. But practice, as always, helps in this case as well. Entering can thus be characterized by the following things. First, it's an awareness of thoughts and actions. Second, it's the awareness of the process of breathing. Third, it's adjusting your daily routine. Fourth, it's attention and awareness that are skills that one needs to acquire. And lastly, and very importantly, getting rid of our obsession with ourselves. The second phase is sustaining. The phase of sustaining is concerned with applying the concepts learned in the entering phase in our daily routine. This phase integrates all sensory systems of an individual, and the individual feels connected to his inner self on a deeper level. The attentiveness and awareness becomes a part of the individual's routine, and ultimately the practitioner's mind is prepared to enter a deeper level of meditation. The sustaining phase is concerned with few characteristics. Let's understand them one by one. First and foremost is being attentive and affectionate. Meditation affects all our sensory systems of the body, so we need to be in tune of it. That's the second characteristic. Third, meditation makes the practitioner feel connected to one's own self. Fourth, the tendency to question our thoughts and deeds arises. Fifth, realization that an individual is a whole in any circumstance. And the last one, preparing the mind to get into a deeper meditation. The third phase is called deepening. In the deepening process, the practitioner learns that liberation is in the practice itself. He or she employs an attitude of non-violence and experiences empathy for others. He teaches himself to conserve the energy that will usually drain out during meditation in the beginning phase. The practitioner spreads his knowledge of mindfulness to others who would need this knowledge. This phase of deepening is also characterized by following factors. First, acting and reacting appropriately. Second, treating others in a non-judgmental way. It's very, very important for any kind of significant relationship to develop. Third, recognizing your weakness and ditching them. Fourth, feeling empathetic for others, to be in the other's shoe, and how other would feel when you're in that situation. You are able to conserve energy during meditation is another important characteristic. Fifth, considering life as a precious gift and enjoying every moment as it comes, without questioning, without doubting. And the last one is spreading the knowledge of mindfulness. The next stage of mindfulness training comes with ripening. This phase is all-round attitudinal change of the practitioner. By reaching this phase, he has mastered how to lead ahead in his life with the right attitude and at the right time. He's incorporated several changes in his lifestyle which now revolve around his meditation practice. Some of the evident characteristics of an individual in the phase of ripening would be he or she is non-judgmental, trustworthy, non-striving, is not competing with anyone, is more accepting of self and others, and is able to let go of the past. The last stage after ripening talks about practicing. After an individual has mastered mindfulness meditation, he practices it moment by moment. He becomes mindful of his eating habits, breathing, body, mind, and also emotions. He has now contemplated mindfulness as pure awareness. Now let's understand what are the various benefits of mindfulness. Mindfulness is known to have several advantages to one's psychological, emotional, and physical well-being. Some of these benefits can be listed in certain broader categories. First of them is interconnectivity of the mind and the body. Mindfulness activates the connection of mind and the body. It develops the interconnectedness of all systems, organs, and cells. This integration makes us more consciously aware of our inner selves. This connection also helps us to develop our inner selves more socially and in tune with others as well. The second aspect is healing. Mindfulness also enables us to achieve physical relaxation, but at the same time, ability to get rid of our fears as well. Moments of stillness during meditation brings along a sense of oneness, that we are already connected with the self and the spirit. Believing in the power of now allows us to be completely engaged in the present moment without being preoccupied by the thoughts of the past or the future. This belief enables one to realize that these are the physical conditions that make us suffer, and we are capable of coming to terms with the situation and transforming suffering into well-being. Another benefit of mindfulness is attunement of the mind. Practicing mindfulness and complete awareness stimulates emotional circuits in the brain. which further bring along several advantages such as increase in levels of well-being, happiness, resilience, and a great improvement in cardiac functions and the immune system. Mindfulness seems to transform functioning of the brain, thus aiding in greater emotional balance. Mindfulness is another benefit in form of relaxation. Though relaxation is not an objective of mindfulness, but it is surely one of its many positive outcomes. Through relaxation, individuals suffering from high amounts of stress and burnout can relieve oneself of stress and other negative experiences. Such relaxation-based mindfulness helps in being calm and relaxed. Another advantage of mindfulness is improving productivity levels. Occupational and organizational stress directly affects an individual's productivity level. A distressed and fatigued employee is someone who works mindlessly. By practicing mindfulness, the employee would be able to manage his stress levels, making him or her a healthier person and easier to manage work stress. The technique of mindfulness, when applied by the employees of an organization, will improve the relation with other employees and will also prove to be beneficial to the organization as well. Next advantage of mindfulness is it leads to a compassionate mind. Mindfulness meditation can train the practitioner's mind to inculcate reactions to most events with positivity. The alterations in emotional circuits of the brain after practicing mindfulness suggest increase in happiness, compassion and optimism. What more can one ask for? It also helps us in making and sustaining better relationships. Intrapersonal relationships definitely benefit from practicing mindfulness, but recent studies have also shown positive outcomes even in case of interpersonal relationships. In a study carried out at University of North Carolina on relatively happy, non-distressed couples, analyzed that couples who practice mindfulness noticed significant improvement in their relationship. Inadequate and inefficient communication in relationship is bound to increase emotional pain between couples. Suppressing one's feelings and emotions towards his or her partner doesn't help either. Mindfulness training for couples is the most appropriate solution for cases of conflict, angers, outbursts, or even divorce. And in our society, as you see, marriage is on the rocks for a lot of people. By bringing in this kind of intervention, we can probably stop breaking of marriages and help incoming families together. Mindfulness also helps us in sustaining and making better societies. The prime objective of the mindfulness movement is to create better societies. Wars and drugs don't make up for a better society. Mindfulness, when applied effectively and efficiently by all, would create a society with positivity and compassion in bold letters. The ease and benefits of practicing mindfulness can help people from any cultural background, age or interest group. So there are no barriers per se. Anyone who wants to do it can do it. There are certain clinical implications of mindfulness as well. Apart from the practical and general domains of life, mindfulness has been found effective in treatment of various clinical problems. According to Didona, major clinical implications of mindfulness can be categorized into 4 categories. First, increased living in the moment time. Mindfulness can be an important technique to avoid the ruminations of the past, or sometimes it helps us by cutting our contact with the past. In most of the clinical problems like depression or obsessive disorders, it is the inability and tendency of the patient to dwell in the past that proves to be a major hurdle for therapy. According to Jane et al., participation in mindfulness training can effectively reduce a person's habit of living in the negativities of past and develop a positive attitude. Mindfulness, if practiced properly, helps individual to attain clarity of thoughts and helps in focusing more on the current things, thus enhancing the quality and enhanced perception of current time. The second benefit he talks about is increased positive effect. Negative emotions are the major cause of many clinical problems. Getting hold of negative emotions and not letting it go drains a person of constructive energies, leaving him further vulnerable for negative and destructive thought processes. Barhofer and others had studied 22 patients with acute suicidal tendencies. They found that after undergoing a session of mindfulness-based cognitive therapy, the level of positive effect among the patients improved as measured by their EEG activity. It also helps in reducing stress reactivity. If we keep the stressor characteristics constant and then see how we react to the stressor and its effect on our health and subjective well-being, we can understand the impact of mindfulness and on stress reactivity better. The studies have shown that subjects with meditation mindfulness experience reach earlier to a calmer state of mind as compared to other normal control group subjects. The researchers also find that all the subjects with meditation experience also exhibited more initial sensitivity to the negative events, but they also reach faster to the stage of equanimity because of their greater ability to let go of negative experiences. And the last factor that he noticed was about enhanced cognitive vitality. Meditation-based mindfulness can help avert the cortical thinning of frontal cortex that is mainly associated with the old age. Age-induced cortical thinning creates many social and emotional problems for the old age people. A study shows that as compared to normal control subjects without any meditation practice, the experimental group subjects practicing Zen meditation possessed thicker cortex area. So this goes on to show how mindfulness is effective for our general well-being and living a happily and fulfilled life. There are several applications of mindfulness that we need to look into. It has application in several areas that we've already spoken about, but let's see some of the major areas where mindfulness has been successfully applied. First, it helps in healing oneself. It has been used successfully to heal people in emotional and physical pain without the use of any prescribed drugs or medical operations. It is a transformative way of healing that is easily applicable and effective. Second is mindfulness in relationships. Couples who practice mindfulness together tend to alleviate their emotional pain and difficulties in the relationship without much effort. It is an effective way to avoid conflicts at home and make one better in dealing with relationships, romantic or otherwise. Mindfulness can also be applied in schools. Successful attempts have been made to apply mindfulness in school children. In one such example or a study, a pilot study was conducted by Mindful Schools and University of California on mindfulness in children. It involved 915 children and 47 teachers. The mindfulness showed statistically significant improvement in behavior as compared to the control group, with only 4 hours of mindfulness instructions given to the students at a very low cost. So imagine if it is done on a sustained and a regular manner, it can help us so much more. Thus, it can be concluded that mindfulness could impact children's behavior in a short time and at low cost. Mindfulness can also be successfully implemented at work. Introducing it at work could help strengthen the foundations of an organization, help the employers as well as employees to increase their self-awareness, raise levels of social intelligence, strengthen cognitive effectiveness, empathize more readily, communicate more clearly, focus more consistently, and last but not the least, direct one's thoughts more appropriately. Mindfulness has a huge relevance in psychological therapies. Mindfulness-based psychological programs have infused psychological practice and counseling in a more effective clinical manner. 3 such widely used programs are being run successfully across the world. First is mindfulness-based stress reduction. It's a therapeutic technique designed and developed by John Kabat-Zinn, who spoke about how mindfulness-based stress reduction was initiated to assist patients suffering from life-threatening issues to deal with pain and difficult life issues. The therapy combines mindfulness meditation, body awareness, and yoga to combat stress through the mindfulness approach. It focuses on the gradual acquisition of mindfulness. MBSR is an 8-week program taught by certified trainers and involve the formal techniques and mindfulness meditation, formal techniques of mindful meditation, body scanning, and simple yoga postures. Also, it has benefits like stress reduction, relaxation, improvements to improve quality of life, but it cannot be distinguished as a means to prevent or cure the clinical disorders. Thus, increasing the number of substantial researchers will help us understand better how we could reduce suffering associated with psychological, physiological and psychiatric disorders, whereby along with other traditional methods, this could be induced to prevent and ensure that there is no relapse of these symptoms later in a person's life. Then also have mindfulness based cognitive therapy. This therapy is an intervention technique mostly focusing on individuals with major depressive disorders. Several researchers have used and worked on John Cabot's mindfulness based stress reduction program, and on the basis of it another model of interacting cognitive subsystems was used in a theory which centered around the concept of metacognitive awareness. Individuals with high metacognitive awareness are capable of avoiding depression, negative thought process. Like Zinn's program, the duration of MBCT is 8 weeks as well. Most of the practice is done out of classes, wherein participants are encouraged to use guided meditations and attempts to cultivate mindfulness in their routine endeavors. Mindfulness-based cognitive therapy is generally claimed as a promising therapy in terms of its clinical effectiveness. Another way it has been used is through acceptance commitment therapy. It is a therapy used in psychotherapy which theorizes that greater positive well-being can be attained by accepting negative thoughts and feelings. It is based on the relational frame theory by Steve Hayes. It's a comprehensive theory of language and cognition that is a byproduct of clinical behavior analysis. Originally called comprehensive distancing, it was developed in late 1980s by Stephen C. Hayes, Wilson and Straussy. ACT helps an individual to clarify their personal values and to also work on them. It also helps in bringing more vitality and purpose to one's life, increasing one's psychological flexibility in the same process. Acceptance and commitment theory can be extremely beneficial in the treatment of depression, anxiety, stress, addictions and other psychological illness. Although the therapy is found to be effective in most problematic aspects, yet there is no evidence that it is more effective than the previously established treatments. Thus, all these aspects that we have discussed so far help us understand that mindfulness is an extremely crucial concept in the well-being of the people suffering from various kinds of psychological disorders or a day-to-day routine deficiencies. So if practiced regularly or if making it a part of our usual lives, daily lives, it can have a huge impact on our sense of well-being and a calm state of relaxation. Now let's quickly summarize what we have learned so far. First, mindfulness meditation is a set of life skills and techniques which have originated from Buddhist teachings. It helps one to realize how to lead his or her life mindfully, that is, with pure awareness and how to integrate with our own selves. It teaches ways to incorporate non-violence, positivity, compassion, empathy, and also to rid oneself of our greed and short-temperedness. The traditional techniques are now being applied in a variety of areas with contemporary changes, yet the true essence of the mindfulness meditation remains unchanged. Entering, sustaining, deepening, ripening and practicing are the various steps of mindfulness. And lastly, mindfulness starting from our own self to others around us can be applied easily and efficiently. Hope and pray that all of you would also inculcate this in your lives besides studying as a part of your curriculum.